February 2018, Ondo State Governor Arakunrin Oluwarotimi Akeredolu, Senior Advocate of Nigeria, assented to the bill for the establishment of the Ondo State Contributory Health Commission and Scheme, consequent upon which Dr. Abiodun Oyeneyin was appointed as the Director General of the Commission with a mandate to ensure that all residents of Ondo State have health insurance cover.
The office we are opening here today is where we are just holding on for a while. The office will be built for this commission, which will be big enough. And on the state itself, we must devise a means by which we will get our people to appreciate this scheme and participate in it. So I want to call on our people, please, it's for your benefit.
The commission has 5 different schemes in its table, with 2 of them already operational and the 3rd now set to be launched. The 5 schemes are Abiyamo Maternal and Child Health Insurance Scheme, the Basic Health Care Provision Fund Program, the Sunshine Health Insurance Scheme for 2 categories of people: informal sector members with over 95% of the population whose means of livelihood revolves around daily earnings, that is the artisans, market women, commercial transport workers, among others, as well as the organized private sector. The Students' Health Insurance Scheme and the Orange Health Insurance Scheme for civil servants and political office holders, which is now due for implementation. The Orange Health Insurance Scheme covers medical, surgical, pediatrics, obstetrics and gynecology, dental, optical and health promotion services at primary and referral levels of care. Enrollees have an opportunity to choose their healthcare providers among a set of accredited public and private health facilities across the 18 local government areas. The Orange Health Insurance Scheme is a family package that covers the principal enrollee, one spouse and 4 biological children below the age of 18 years, while an unmarried principal enrollee will seamlessly bring on board statutory dependents whenever he or she gets married. The stage is now set for the commencement of the scheme.
The administration of Mr. Governor Arakunrin Oluwarotimi Akeredolu, Senior Advocate of Nigeria, emphasized this by keying into the health insurance scheme to ensure that we have a productive workforce. And health insurance is the financing model to bring succor to people by making an affordable contribution, and at the end of the day we have access to wide array of health services. So for a public servant that contributes as low as 500 naira a month, then that public servant, the spouse and 4 biological children can have access to array of these services. It's hand joining hands. It's a pool of resources that will be a benefit to all and sundry within the civil service workforce.
Presently, the government has done everything possible to get the civil servants to buy into the program, and that's the first level in which we expect the people to participate. And the government on its own side has committed a higher percentage compared to individual enrollee to supporting it. And I can tell you, over the months, the government has consistently paid its own side, and with the civil servants coming in, I tell you, and I'm very sure that everything is in place. The government is really committed. The state government has also invested so much in technology. The technology know-how there is second to none in the state.
Yes, the implementation will be sustainable. There is a sustainability plan embedded in the law. There is a law already. It's not just an agency. There is a law of the State House of Assembly. So it is not easy for any government that comes thereafter to do anything untoward about it.
Governor of Ondo State, Arakunrin Oluwarotimi Akeredolu, has given his assent to the law that established the Drugs and Commodities Management Agency in Ondo State. And the goal of this agency is to ensure uninterrupted supply of drugs and commodities in our health facilities, primary, secondary, tertiary. And I want to assure you one that most of these facilities will be the one that will be enrolled under this program. They will have access to qualitative drugs.
Premium contribution under the Orange Health Insurance Scheme is progressive, with a fixed percentage contribution ensuring that those who earn higher pay more and vice versa, covering the civil servants until he or she retires and the political office holder till he or she exits from office. The state government magnanimously agreed to contribute 60% of the premium due for all public servants. The scheme for retirees is currently being developed.
The governor of Ondo State is committed to the Contributory Health Insurance Scheme in Ondo State. And Orange Health Insurance Scheme for public servants is one of the products. According to the law that established the commission, premium and remittance is put as, that means it will be released as and when due.
We are enrolling people by uploading their data. All they have to do is to do data capturing. So the work environment, they continue to do their work in their MDA, and when they come for enrollment, maximum 5 minutes, we are done with them. We allocate them to hospital, and they can enjoy seamless services across the accredited government and private healthcare professionals, whichever one that they choose to use.
Is 64-year-old Jimba Adeola, a retiree who has lost his wife and barely surviving on account of various challenges buffeting his life. Mr. Jimba Adeola is one of the 20,959 beneficiaries under the vulnerable group of the Basic Healthcare Provision Fund program. But for the scheme, it would have been a different story altogether, with the fear that he might have been forced to premature death.
Mo dúpẹ́ lọ́wọ́ ìjọba Ondo State fún oore àánú rẹ̀ fún lórí wa lórí mi tó gbé ìwòsàn ọ̀fẹ́ yìí kalẹ̀ sí Ọlọ́run máa ràn án lọ́wọ́.
And again, the Abiyamo Maternal and Child Health Insurance Scheme, a state equity scheme for 2 sets of vulnerables, pregnant women and children under 5 years. A fully funded program by the state government, it was launched by Governor Oluwarotimi Akeredolu, Senior Advocate of Nigeria, on the 3rd of December 2019, and it has since inception made maternal and child care services available at no cost to the beneficiaries in the Sunshine State. It gives access to antenatal care, delivery including cesarean section, postnatal care for the mother, and neonatal care and treatment of common illness in children till they attain the age of 5, with beneficiaries not paying a dime for covered services. The pre-qualification criterion to enjoy this scheme is a Kadi Biayo, Ondo State residency card. The premium for the Abiyamo scheme is solely paid for by the Ondo State government with a state budgetary line yearly. So far, Abiyamo scheme has recorded over 24,250 beneficiaries, made up of 15,934 antenatal visits, 8,129 deliveries, 2,015 by cesarean sections, birth of 191 twins, 5 triplets, and 2 quadruplets. Abiyamo scheme providers are spread across the 3 senatorial districts of Ondo State. This is Motadole, a sleeping community in the outskirts of Ondo City. Getting to Motadole is more of a Herculean task, where miracle, marvelous and mercy, a set of triplets born on the wings of Abiyamo scheme, are basking in the euphoria of life.
Marvelous, move. Mercy, let's go inside.
It is the story of Alatubi Mercy Motorayo, a university graduate who was barely struggling to survive with 2 children already, and the hope of just 1 additional child when she got pregnant only for her to get the biggest surprise of her life when the result of the ultrasound scan revealed otherwise.
All through the time, the care was there. The doctor was like, this, my patient, calling series of other doctors in order for them to put us together so that the delivery will be safe. So it was during the CS day that the baby was brought out, the first baby, the second baby. That was when they now shouted that it still remained one. They discovered that it was now triplets. So after taking the delivery at that time with this Igbeayo, yes, antenatal Igbeayo. So anybody that registered with that Igbeayo, we were told that the delivery will be free. Either it is CS or normal delivery, and that delivery too was free.
She sells popcorn to survive, and the husband, who works in a private firm, is finding it difficult to financially sustain the family. All hope was lost.
Because when I gave birth to these children, even tears rolled down from my face.
But for the intervention of the governor, Akeredolu-led administration through the Abiyamo scheme. Coming over to Akure are the quadruplets born to the Oludare family under the Abiyamo scheme.
Mo ti lò ọ̀sẹ̀ méjì ní hospital kó tó di pé mo bímọ. Mo ní káàdì Igbeayo. So wọ́n ní àsan owó bed, àsan owó yẹn. So wọ́n ní kí n máa lọ pé ọ̀fẹ́ ni pé mi ò san owó. So mo dúpẹ́ lọ́wọ́ gọ́vnà wa ní ìpínlẹ̀ yìí fún ìrànlọ́wọ́ tó ń ṣe fún gbogbo àwa aláboyún. Mo dúpẹ́ lọ́wọ́ wọn gidi fún torí pé wọ́n máa bá wa tọ́jú àwọn wọ̀nyí títí tí wọ́n máa fi pé ọdún 5. Gbogbo ìgbà tá bá ti ń lọ clinic ọ̀fẹ́ ni a máa gbóògùn gba gbogbo ìwòsàn.
In similar vein are the twins of Mrs. Akinfemiwa Bukola, who hails from Okitipupa but resides in Akure. For the 38-year-old tailor, her gratitude to the Akeredolu-led administration is endless for enabling access to delivery and maternal care at no cost to her.
Èmi ti rò pé operation tí mo fẹ́ ṣe pé ó máa ná bí 200,000 ṣùgbọ́n mo wá dúpẹ́ lọ́wọ́ ìjọba arákùnrin Akeredolu pé wọ́n kú ìtọ́jú wa, wọ́n ṣe bẹbẹ fún wa, a san owó. Wọ́n ní téèyàn bá ti ní káàdì Igbeayo kò nídìí kó san owó. Lè lọ gba káàdì Igbeayo. Ìgbà tó ń dẹ̀ ṣe fún mi náà mi ì san owó. Ọ̀fẹ́ náà ṣe operation fún mi.
Buoyed by the legions of success and testimonies from about 45,000 beneficiaries under 2 operational health schemes of the Ondo State Contributory Health Commission, the birth of the third portfolio, the Orange Health Insurance Scheme for public servants and political office holders, is certainly anchored on a sure footing. Welcome, Orange Health Insurance Scheme.